Hi, everybody. This is Chris with Readiness Rewired. And Al, what time is it?
Hey, Chris, it is time for another Readiness Rewired Healthcare Preparedness podcast. And this is another one for our listeners that our three-legged stool is missing that leg again today with Mike being out. But I think our guest is going to be our third leg of our stool today, so we don't fall over and crash and burn.
I think she'll be our superstar. So with us is Angela Leek, and we've known Angela in the emergency preparedness business in a couple of different roles, but we're going to let her introduce herself and then have a conversation with her. So Angela, welcome.
Well, thank you so much for the opportunity to join your podcast and to talk to all of you in the community. My name is Angela Leek. I, for the last 16 years, was the Radiation Control Program Director for the state of Iowa in the Bureau of Radiological Health. So technically for the last 10 years, I had done that. Prior to that, I was an inspector for mammography inspection and also radiation emergency response. So a lot of the responses that we practice have to do with nuclear power plants around the state. So I have a lot of experience with healthcare emergency managers, county emergency managers, state Homeland Security, and then of course the Health and Human Services Department. About a year and a half ago or so, I left the state government and went over to a consulting company called SummitET Exercises and Training. And so I've been working with other states, including Iowa, to support them in various aspects of radiation control. So staying in the radiation control business, I'm a certified health physicist. So radiation has been my passion for the last 25, 30 years. And I did start my radiation journey as an X-ray tech. So I worked in a hospital, Mercy Hospital in Des Moines, did my training at the University of Iowa Hospitals and Clinics. So yeah, I've been around the horn in the radiation world and the medical world before I started down the path of where I'm at.
And I would say too, from my experiences in working with you, is you're very active in emergency management. I think you were on a crisis standards of care committee, providing some insight, and definitely involved in the development of a lot of stuff. If not personally, in charge of it, you certainly knew what was going on at the federal level, or know what's going on at federal level in terms of development to support emergency preparedness and management folks when they're responding to radiological or radiation incidents. So it's one of those things I think that are on all of our lists, whether we put it in that hazmat category or a separate one. And clearly there's been some federal interest and emphasis maybe for the past year and a half. Al, you've had some work that you've been doing with some folks in that area, haven't you?
Well, yeah, and that's, before we started the podcast, that's why I mentioned Angela. I'm surprised we haven't run into each other, because Angela being in Iowa and working in the hospital system with a couple hospitals in Iowa, a couple in Illinois, Angela, we have in our area, we have the what used to be Exelon, now Constellation nuclear power plant over in Cordova. And with that, we're doing exercise. In fact, we just finished exercises in 2 of our Iowa campuses. The Iowa people, I say, came in, and one was a FEMA evaluated, one was not, because we were on the off year, which is surprising how I haven't run into you. And maybe I've seen the name and just not caught it before, but I don't think we've ever physically, connected from a standpoint of an exercise or a drill. So I'm curious, from your radiation control disaster director, Iowa kind of relationship, how's that all work? Tell the listeners and explain a little more about how Iowa gets involved, because in Illinois, we're right by the plant. So one of our hospitals is the plant that services the employees of the hospital. Our other 2 hospitals that I worked with were MS1 medical stations. And that's where Iowa group comes in. They check our medical stations. They were just in here checking with our EMAs, because we're in 2 different counties, and going through that whole routine, which is really good really good training and really good exercising to go through and cocoon all the patient. But back up and tell me how does Iowa function in all of that, and what do what have you done?
Yeah, I'd be happy to. So there's a couple of different ways that radiation emergency response works. So one of them, that's the big one that a lot of people participate in, is the radiological emergency preparedness related to the requirements for the nuclear power plants. So all nuclear power plants across the United States are required to have off-site emergency preparedness as a part of their license to operate. So FEMA administers that. So that's why every 2 years there's an evaluation of the plume phase of the exercise. And there's a whole rep program manual that outlines all of the things that the plan needs to include for the entire community, whether it's on-site or off-site, which means on-site at the nuclear power plant responsibility or an off-site responsibility. And then there's various players in off-site, right? We've got the state, we've got other agencies within the state level, then you've got the county and the various entities within the county government. And then you've got the hospitals and other response agencies that have a part, even like a Red Cross. And so that plan gets put together and evaluated by FEMA, and then practiced and demonstrated to FEMA on those frequencies. So in Iowa, Homeland Security Emergency Management manages the REP program as far as the planning and the coordination with the plant, all of the funding streams and all of those things, the program management. And so they have a site specialist assigned to each of the plants. And we used to have multiple plants. We had one at Duane Arnold Energy Center in Iowa, near Cedar Rapids, in Palo, Iowa. That one has been shut down since about 2020. I think the derecho came through and actually knocked down the cooling towers, interestingly enough, and they were planning to shut down in October of that year, but they ended up shutting down in August when that occurred. So that was interesting. We used to have also one over on the east side or west side of the state, in Fort Calhoun, Nebraska. And so that one shut down even before that, maybe in 2016 or 17, if I'm remembering correctly. So the Quad City Station is the one that's left for Iowa to play in as far as an emergency planning. So Homeland Security coordinates everybody. Health and Human Services, which is where the Radiation Control Bureau lives. And that agency has a big responsibility on dose assessment. So they're getting information from the plant, doing a bunch of calculations, figuring out what the risk is, and whether or not the radiation exposure is worth moving patients and moving people, general population, whether it's evacuation or sheltering, like we all remember doing during COVID, those kinds of things. So they're weighing those risks and those items, and then advising the governor's office. And then the governor's office makes a recommendation to the counties, because Iowa is a home rule state. Then that recommendation goes to the county decision makers, and then they decide what those next steps need to be. So that happens throughout the whole exercise. And again, the healthcare group is a very important component of this, because we're going to have people arriving at the hospitals, either from the plant site, but with the plant in Illinois, not so many will come over to Iowa because they have that dedicated facility in Illinois. But we might have some public who get in car accidents as they're evacuating, or want to be evaluated for contamination and all of those kinds of things. So the Health and Human Services Department would support the healthcare groups as they're administering that. And probably the reason we didn't run into each other, Al, is a lot of the MS1 is handled by Homeland Security, and they come out and help the plant. And so Health and Human Services doesn't always get to come out and play with those. They're usually in the State Emergency Operations Center behind the computer, talking to the plant and doing all those calculations. So we don't often get out there, although I do know we try to, or have historically tried to get out there so we can meet a lot of the hospital staff. So.
Well, and I don't want to give our listeners the wrong impression, because I have met a lot of people from the state of Iowa, from the university, from Iowa State University, who handles, some of the radiation stuff for us and everything. And because we sit on the Iowa-Illinois border, that plume, the river doesn't stop the plume. It does come over into Iowa, even though right across the river is the radiation, or is the station. So it's interesting, but it's been a lot of fun. And I think what maybe some of our listeners don't realize is, you mentioned the hospital is a component of. It was amazing to me when I went through the first drill that the state works with our EMAs. They work with
Mhm.
various communities for community set for gathering centers. Because
Mhm.
we are going to have the worried well, and we are going to have some potential people who could get exposed. Knock on wood, it's never happened, and we hope it doesn't. But the planning behind the scenes is simply amazing.
So
Yeah, I'll
so
I'll
can I?
add to that. Yeah, go ahead.
No, go ahead, because you finish that comment, and then I want to do a little level reset because we're off on
Okay.
nuclear
Yeah.
reactors, and we need to talk about
Yes.
some the broader picture.
Yeah, that's what I was actually just going to say was, there is a lot of planning that goes around the nuclear power plants, and there are set places where community reception centers, which is where screening and decontamination happens. They're all set, pre-staged, very, very planned. But that's one small area of the state, right? 2 counties, 3 counties. And so when we think about a radiological incident, it can occur for many reasons. There's other types of incidents. Some of them that are in the big planning scenarios are called a radiological dispersal device. So that can happen either through an explosive mechanism, which is, a regular improvised explosive device that maybe a bad guy would put together and place somewhere. Think Oklahoma City bombing, things like that. But for an RDD, or radiological dispersal device, they get their hands on some radiological material and put it in that device. So then it gets spread around. And now instead of just having a blast, we now also have contamination everywhere. The other type is potentially like spraying, whether that's through like a crop duster or like a drone dispersal. There's many different ways that can happen. We can also have transportation incidents. And so, of course, we've got I-80, I-35 that go across Iowa. And radioactive material is transported every day. And so if there's an accident, it's unlikely that there's going to be a large spill or anything, because the transport packaging is very robust and it's meant to keep everything inside the package. But there's a possibility. So if any of that would happen any other places of the state, we're still going to need that community reception center. We're still going to need the hospitals to know what to do with contaminated patients. And I really think that that's an important thing that hospitals can do. Many of the healthcare coalitions will remember coordinating, not this past year, but the year before, something in 2022, the HPP grant, or I'm gonna have to have help with that acronym.
Yep,
But the
Hospital Preparedness Program. Yep.
Yes, thank
yep,
you.
yep.
The Hospital Preparedness Program grant required planning for radiological incidents with the healthcare coalitions. So we did a lot of work, particularly with my role in Iowa. And then as I transitioned to my consulting role, I started to also work with the University of Nebraska Medical Center. And they have a regional healthcare disaster coalition support system. It's called the R7DHRE. So it's the Region 7 Disaster Healthcare Response Ecosystem. And we'll put a link out so they can find those resources. But we did a lot of support and planning with all across Region 7 about how hospitals can plan for receiving patients and help support setting up these community reception centers on the fly, because we don't know where these incidents will happen. In a nuclear power plant, we know the zone, we know the area, we can pre-stage locations. But in any other incident, we don't know where the incident's going to occur.
So isn't there also industrial radiation?
Yeah.
I mean,
Yep.
there's, I remember Firestone in Des Moines has
Mm-hmm.
one area that has pretty restricted access that does it for, it's involved in tire curing, I believe, or something like that. So the
Yeah.
possibility of maybe a more limited, again, unless somebody did something that was deliberate, intentional in terms of a release, that possibility or the scenarios, they probably need to work with someone like you to come up with a realistic scenario, but they can probably find something to fit almost any area of the state, either because of transportation incident or maybe because of something, maybe a source that they're not aware of. Um, would
Yeah.
you ever, would a medical source ever be hazardous in terms of a major incident? Would it malfunction and with the safety features just shut itself down? Or is there a possibility that you could see something in any healthcare facility that's got a radiological component?
Yeah, so I want to clarify just a couple of technical things here,
Hmm.
just so that as we talk forward, everybody has the same perspective here. So there's many sources of radiation, and so we have radiation machines. That's what most people are familiar with in the hospital: CT scanners, X-ray machines, and even in an industry, there are devices that actually emit X-ray. And in those cases, if we unplug the machine or aren't pushing the exposure button, there's no radiation coming off and there's no risk of any radiation. So then where we really have these kind of these areas we need to control because we can't turn the radiation off is in what we call radioactive materials. And radioactive materials can be presented in multiple ways. Often they're sealed sources. So that means they're double encapsulated, sometimes triple encapsulated, welded. So the actual material itself is within a little metal pellet, and could be really, really small. And you're right, in industrial settings, those are present a lot of times in industry as gauges. So is something getting full? Is the flow being consistent? I think there's a glass manufacturer over in Eastern Iowa that uses radioactive material to measure the thickness of the glass because it's molten and it's really hard to measure. So they use radioactive material to do that. So when it's sealed, it's really going to be just an exposure potential. So kind of like if you're standing in front of a flashlight, you're getting exposed, but it's not nothing's getting on you. When you walk away from the
No
flashlight, you're no
contamination.
longer being
Right.
shined
Yeah.
on, right? So,
Right.
so if you walk away from the source, you're getting just exposure. The medical isotopes, though, they are meant to be injected into people so they can go around the various areas of the body and show us what's going on. So those are called unsealed sources. And so those can be spilled. Those can have contamination potential a little bit more than some of those sealed sources that are running around in industry. But again, the practice, the use of that is very controlled. And medical isotopes are very short half-lives, which means that they're going to decay away quickly. And once they're decayed away, they're no longer emitting radiation. So we can, just treat it like any regular spill after it's decayed. So it can pose a risk while it is immediately, spilled or where it's not supposed to be. But again, those medical isotopes are meant to be injected into people. So the amount of risk is really low because they're meant to not harm people from the radiation exposure.
Awesome. So I think you're pointing out that exposure versus contamination, where exposure can cause something, but the person that has received that exposure isn't a risk to somebody else. Maybe like that flashlight analogy that you had, or sunburn is a form of radiation, right? So if somebody's sunburned and they go in for treatment, nobody is going to be injured by the fact that their patient's sunburned. But if they're contaminated and have that, then that's an issue, and that's a real concern. And then I think the other issue that's challenging in the medical treatment aspect is a lot of the illness that results is not right away. I mean, if it's really massive, it's within 24, 48 hours, but sometimes it's days later. So there's an incident and exposure that's significant. So some of the people could, in a panic, leave even in those immediate areas, or maybe not even know that they're exposed. So having a basic literacy about this sort of incident and how to manage it makes sense to everybody, regardless of whether you think you're near a nuclear reactor or a radiation source, is that people do travel. The worried well, as Al mentioned, may show up there. So, really what you're talking about isn't just for a few pockets or areas. It's for everybody to be, it's emergency preparedness anyway, prepared for. Does that sound reasonable?
Yeah.
And I'm glad you went down there because you're right. Chris knows that I go down a rabbit hole once in a while because I'm dealing with nuclear radiation all the time and don't think of, and for some of our even our emergency preparedness people out there away from nuclear power plants that don't have that understanding. Because again, Chris is clinical, I'm non-clinical. we all have a role to play, but I try to understand my weakness, in emergency preparedness and reach out to people like you, Angela, that
Mhm.
knows radiation and can clarify for people, oh, here's what you really have to think about, and put it in the right frame of mind, And so thank you for doing that, because I truly think there's a lot of people around the state, and even a lot of preparedness people who have not been exposed to this, that maybe even they do a radiation drill and they think, oh, it'll never happen to me, but they don't think of the various incidents that could happen, not to scare fear in everybody, but to say, hey, the state's more aware and prepared and ready to respond than what people might think.
Yeah, a couple points on that. So I do want all the listeners to know that there are resources out there. Just like you said, just reaching out to the people that work with radiation every day or involved with those types of radiation protection things every day. You know, Healthcare workers and others, they have other jobs that are their focus, and so we want them to feel comfortable working in radiation and understanding what to do. But the most important thing to know is that you have resources. And one of those resources that's really strong is the Iowa Health and Human Services Radiation Bureau. And they collaborate with Iowa State University and the University of Iowa and others to put together a team. They also leverage the national program, which was one of the programs that I still work and support, called the Radiological Operations Support Specialist. And so across the nation, we've got almost 500 now, individuals from various walks of radiation background who've gone through this ROS training and are working on getting qualified. So it's a NIMS typed position. So there's ROS
Okay.
types 3, 2, and 1 at various stages of experience, particularly in supporting states in responding to a radiological incident. So, you can ask for a radiological operations support specialist. It is in the Iowa plan to embed those individuals and reach out to the rest of the nation to EMAC, so Emergency Mutual Aid Compact, to make that request. So those individuals could be placed in a hospital and just be standing right next to you and putting things into context, getting you the resources that you need, helping to connect you with the resources that the state has. And so definitely, if you're looking at your plans, think about putting in the fact that you could reach out and request a ROS. So, but yeah, and then the second piece I think that I really wanted to point out when you mentioned a little bit ago about radiation exposure, it would take a lot of exposure and it would be a very unique situation. Even a nuclear power plant incident would not put us in a place where we would expect a lot of people to be having acute radiation syndrome. And acute radiation syndrome is that where you would have physical symptoms or manifestations of the exposure from either standing in the beam or having contamination. Either way, if your body receives enough radiation, you can reach that. But it is a very high amount. We wouldn't be expecting very many people at all to have that. So when people are thinking about a radiation incident or someone's going to be coming in with contamination, you are correct. They would not, if somebody comes in throwing up, that's one of the first symptoms that you can look for a high radiation exposure. It's much more likely that someone having vomiting or nausea is having a vasovagal type reaction or some other physical issue
Anxiety.
going
Yeah.
on than the radiation exposure. So it'd be really worth asking the question, but you want to make sure you rule everything out and make sure you ask those questions. But one of the jobs of Health and Human Services and of some of the radiation people is to do dose reconstruction. So they can look at the situation, see what kind of a material was involved, what kinds of rates of measurement, like dose rates we were seeing. And they could say really quickly, like, no, if that person was in that area, it's very unlikely they got enough radiation exposure to have physical manifestation. So it can help with that treatment guide. But that is, yeah, even if somebody did for some reason receive that high dose, it's physical symptoms aren't going to be the first thing you'll see. Maybe some blood changes and white blood cell counts and things like that. But again, it's going to take time for us to be able to see that. So the most important thing is to write down their name, make sure you know how to find them again, so that if we took blood or we're doing urinalysis over a period of time, we can get back to them when we have a good idea of what exposure they actually got.
Did you want to put another plug in for that um, Region 7 ecosystem? Because that's a multi-state
Yeah.
organization. That's got some resources too, right? Because really what you're trying to do is build literacy, hopefully beforehand, so that we don't have the rumor mill and conspiracy theories and all that end up making it really difficult. And again, being inundated with the worried well that think or heard something. So educating people ahead of time, both the responders, but maybe to pass along to our medical community. So they've developed some stuff that's on their website. What sort of stuff? They have exercise, not necessarily exercise guides, but planning guides. And do you know what kind of resources they have on there?
Yeah, absolutely. So, and just for the listeners, Region 7 is our resource here for our, Iowa and Nebraska, Missouri, and Kansas area. But there are other systems across the country that are doing similar work in their regional areas. And they have what are called, or at least in Region 7, we have radiation specialty team. There's a biological specialty team, chemical specialty team. And we work closely with our regional resources to create website content links. So if you come out to the radiation specialty team page, you'll be able to find links to your radiation resources within each state, who the radiation control program directors are, emergency numbers for those types of things, non-emergency numbers when you want to just work on your plan with them. We also then give links out. We're trying to do our best to create some just-in-time training, like how to turn a radiation meter on, how to deal with contamination. And so just little 2 to 3 minute videos that answer the specific question you might need to be dealing with if you see yourself in the middle of an incident, and you don't have time to go back to that 30-minute training and go find that little nugget of information. So we're creating some of those links, linking out to really great resources on the CDC website, Centers for Disease Control and Prevention, and I'm trying hard with acronyms here.
You're very good, doing really well.
And so we're trying to just create those links so that, we're helping to digest it, put it into something that means something that's relatable to our region. Radiation stuff can, transpire all areas across the country, but sometimes it's nice to have it just whittled down to what you might need to use as a healthcare coalition, as a hospital, and just get the stuff that you want, and then links to more information if you want to have that. So our site's under construction, but definitely go out there and see. We're continually adding more links, more sites. And then again, when we have template plans that you can use, we'll put those out there. They'll be a copy of what other states or other regional partners have done. So we just share the wealth and not have to reinvent the wheel for everything we're all trying to do.
Awesome. Hey, is the civil support teams, from the national, what was it, the Army or the National Guard? Boy, that sounds bad. Me not knowing, but in our area, the 71st Civil Support Team, they're kind of equipped under, I think it's the governor's authorization. Can you speak a little bit to them and their role?
Yeah, so the civil support teams are a great asset that we have as a civilian military support function. So the governor can deploy civil support team as a civilian asset. And each state has one, if not two, depending on how big their state is or how populous their state is. They have a lot of reach back capacity up into the military as well. So they can force multiply, bring in other civil support teams or other groups to support. But they are very much a partner across the radiation. And they're the entire CBRN, or chemical, biological, radiological, nuclear spectrum. So they can assist with white powder, chemical types of incidents. But from the radiological perspective, they can bring resources to help look for radioactive sources before they're an issue. So they do a lot of interestingly, they do a lot of those types of missions alongside our security partners at universities or other large events across the state. They will do a sweep looking for radioactive materials and other things. They will monitor while the incident's going on. So like NCAA tournaments or big football games, state fair. They set up monitoring, and they're out there looking from a technical perspective for any security issues that might be going on. And then they really partner really well with Health and Human Services and do outreach to all of our hazmat teams across the state, so that everyone understands what they have for resources and expertise. And most importantly, that everyone knows who each other are. So you're not meeting yourselves at the first, meeting each other the first time on an incident. So everybody's been working together. So they are a really great asset for Iowa, for sure.
Awesome. One of the things I think that is often confusing, if you don't mind addressing this, as far as recognizing an incident and maybe involving something radiological, is surveying versus a dosimeter, and somebody getting some equipment for just frontline preparation. And I know you've helped, I think, folks sort through that. What are those kind of general categories, especially for healthcare, so that when people look at it and go to grab it, it's going to be functioning in the way that they're expecting it to, for the reasons that they're expecting it to.
Yeah. Yeah. So radiation, number one, which is great, is about radiation, is that it's super easy to detect. So almost any piece of equipment will detect radiation. Now, that means that we need to know what the numbers mean. So just because a radiation meter is going off doesn't mean that it's bad or that it's abnormal, because we have radiation around us all the time. So we need to know what background is. And so it's really important that if somebody has any piece of equipment, regardless of what it is, that they get it out periodically and they know what normal is around their area. So that way, because if a radiation meter is reading 0, something's wrong with it. So it should always be reading something. So, but from that perspective, then there are a couple of different types of equipment that I think would be of particular importance for healthcare facilities, particularly to pay attention to. The most important one is called a pancake probe. And they make new ones now that are all in one. Some of them connect to other boxes and devices. But what that will do is detect contamination. So that is what we would use to kind of survey a patient to see if they have any contamination on them. It'll pick up radiation in the atmosphere and in the area as well, but it's really designed and best used for surveying for that contamination. There's another device. A lot of the first responders or hazmat teams will have what's called a personal radiation detector, or PRD. It's something they can wear on their belt. It's meant to read in like a dose rate. So you might see like milliroentgen per hour or like an MR per hour on it, where the contamination pancake probe would call counts per minute is usually what it reads in. And so, but that having that other device lets you know kind of what the rate of the radiation in the area is. And then that can help with worker dose estimation. It can help with, whether or not that area needs to be treated as a hot zone or not. And that kind of a dose rate comparison. So those would be the two minimum types of equipment that I would say would be handy to have around, just so you know what is there. We could do a whole training on just equipment and what the measurements are. But I will say about contamination, there is an established counts per minute that's considered contaminated. And it's, I think in Iowa, still 1,000 counts per minute. So if it's reading 900 counts per minute, they're considered clean. If it's above 1,000 counts per minute, then you would send them on for decon. So that means that meter is going off a lot more than you've ever heard it before. And so I think it's important for people to understand that. And the way that happens, I mean, people are always like, how can the meter be going off this much and it's not something to worry about? And the big message to take away there is, some radiation is not necessarily going to be dangerous. And so we want to make sure that we're leveraging our resources for decon, because it's not insignificant to go and decon someone, and it can take a long time. But if they need treatment, they need something. Should always treat the patient first and take care of the contamination later, if they have critical life-saving things that need to be done. But even so, we don't need to be spending our resources for something that is going to be very minimal. And there's a lot of guidance documents out there that give us that reference level for cancer risk or other types of health impacts. And so those numbers that are being given to you by Health and Human Services are based on those reference documents. So sounds like a lot of clicking happening on the meter, but I promise you that if they give you a number, it's based in science, it's based in a health risk impact, and it's okay to be considering that clean. So
When Angela, a lot of people or a lot of employees as we bring them in are surprised. You talked about background, and you talked about normal clicks in the detection equipment, and like in our homes, if we've got, correct me if I'm wrong, I think isn't the granite countertop gives off some radiation.
it can.
There's yeah, it can. There's different things that can give off, and to treat it and to protect yourself, very simple PPE, protective equipment, for the healthcare provider, and you know we teach everybody it's a simple, if you know how to wipe a baby's butt, and it's that simple, you know how to decontaminate radiation because you use a wet wipe, a non-alcoholic wet wipe, and you're wiping and cleaning the surface. Now, let's exclude internal
Yep.
contamination, but this is external contamination. People, all of a sudden their anxiety level goes and they
Mhm.
relax a little bit because they go, oh, it's not as, they see these movies where the people come in these great big garbs and breathing apparatus and everything. Radiation's not anything as scary as that. It has to be addressed, but it can be addressed very simply.
Especially for the healthcare workers, right? By the time the patient's coming into the hospital or you're receiving those people, there are some conditions where people are going into the front line of the incident where they do need some of that PPE and they do need to take some of those precautions. But you're right. In a healthcare facility situation, uh, there's a story I'm sure you guys remember. I think it's Alexander Litvinenko, was a Russian spy. He was poisoned with polonium, which is a radioactive material. It's
Yep.
an alpha emitter, and without going into a lot of detail on what that is, it's very difficult to detect with radiation equipment. So he came in, and they were suspecting poisoning, but they didn't suspect radiation to be it. So he was in the hospital throwing up, having those ARS symptoms, having all these things, having all kinds of tests done in the hospital. And everyone was using their regular standard precautions. And the healthcare workers, none of them received significant doses from caring for that patient, even though they cared for that patient the whole time, the majority of the time, without knowing radiation was even considered. So, for alpha, as long as we don't get it in our body, we're pretty good with alpha. Now, gamma, we can get some exposure from the patient by standing next to the patient, still very minimal. But honestly, time is our friend and distance is our friend. So if we put on a lot of extra garb that we don't need, it might actually slow us down from doing our job. And we end up standing near the radiation source longer than we would
Mm.
have without any of it on. And we actually increase our exposure that way. So it is just try not to get it in, and, masks and gloves and, changing that out just like you would for a biological that you can't see would help take care of the radiation as well.
Mm-hmm.
So, in most plans, and Ella mentioned this, and I think I did too, about the worried well, about people hearing about an incident and then, well, I think I drove by there or whatever, the worried
Yeah.
well, the communication, uh, who is who's the agent of communication during those sorts of incidents? Is that public health or is that another entity? Uh, and are they on social media to really manage that?
Yes.
I'm sure it's a concern, and
Mhm.
pre-education is a big part of it. And I think that's been addressed with healthcare, but we don't be inundated with these hundreds and thousands of people that really have no business coming to hospitals and clinics. So who manages that?
Yeah, so that is a really important component of radiation. Um, it is so the communications piece is a shared responsibility, usually through a joint information center, which hopefully the local agencies and entities like larger health systems would be a part of that messaging. And of course, medical professionals are trusted resources in health questions, right? So we expect that people, when they're concerned about their health, are going to want to talk to their doctor or want to go to a health facility, but in an incident with radiation, especially if we had an explosion or other things that people have injuries from, we don't want to inundate the hospital from their normal operations. And I'm sure many of them already normal operations even without a regular incident, they're busy and backed up, right, in the ER. So
Right.
that's community reception center is of key importance, so that's somewhere people can go, whether they're contaminated or not, get resources, get information, get reassurance. And that's typically handled by the public health department. Could be the local public health department. It could be in collaboration with a group. It could also be EMA. It really depends on that local jurisdiction on who can best secure logistics of the facilities that have all the correct, sinks and bathroom facilities and registration, enough room for people to line up without freezing in the winter. And, EMA has a big piece in that. But then the healthcare side, whether that's the healthcare facilities or public health, can help bring people who can help with mental health and reassurance and, the actual screening and decontamination of people from the radiation perspective. And Health and Human Services can send individuals to help support that as well. So I think that a big collaborative approach is of utmost importance, and just knowing what is needed and then who can best bring those resources if and when it's needed. And then everybody can come together to make sure that those worried well, for lack of a better term, have those resources available to them. Now, the healthcare facilities themselves, when they get patients, they'll be getting information from those people doing the calculations, and they'll likely get maps that will say, hey, if the person was here, up in this northern part, and they came to your hospital, you're not in, they didn't even traverse anywhere with radiation. It's very unlikely they've gotten any exposure. And so you can kind of have that information. But regardless, we will register everyone who's been, Health and Human Services will register everyone who's been remotely involved, and there will be follow-up ongoing forever. So
Awesome. Yeah. So tell me, I'm going to kind of direct this to you, kind of pointedly, that your role now is focused on exercises and training. And it sure sounds like these different components, as you mentioned before, we need to visit with those specialists and those resources and try them on and practice with them. The Joint Information Centers can practice messaging and really, because it sounds like there's a lot of collaboration, and collaboration's clumsy at best for people that don't know one another. That is this something that you do now in your role with this with Summit? In fact, Summit sounds like that's their focus.
Yeah, so the title and the name of Summit Exercises and Training, so that's it's Summit Exercises and Training, sometimes shortened by SummitET. And it's really a preparedness solutions company. And so we do a lot of radiological exercises, but we've done some burn tabletop exercises. We have a lot of law enforcement support, and we have the work that we do with the Region 7 disaster healthcare response ecosystem, and all of those aspects that we can bring subject matter experts from the correct area. So for myself, for radiation, we've got another health physicist in-house as well. And then we can reach out to other state partners within the Ross community and bring the right resource in to help support the development of a plan, the practicing of certain aspects of a plan. But honestly, it can be overwhelming to try to hit all of it at once. So I think you hit the nail on the head by saying, if you want to practice communication, let's bring all the comms people with the right support structure, make sure we know where everyone's coming from, who has what authorities to do what. And then, if that's going to bog us down, let's work on how we can get rid of some of those roadblocks. And again, just be familiar with everybody before the incident actually happens.
Awesome.
So yeah, we do that.
Oh, sorry. Yep. Hey, Al, questions as we kind of wind up?
Not more of a statement or a comment, and then see what Angela has to say, because you asked, Chris, you led into the consulting role that Angela is doing now, which will give our listeners, some of that information. So if they want to reach out and do an exercise or something, they've got a great resource to do that, because it is sometimes very easy to put exercises together, and sometimes very difficult to put exercises together. And I should say meaningful exercises that accomplish and train and educate people. And that's where Angela and people like that come in. So I would encourage people to, say, hey, if we're interested in this subject and the hospital or the facility or whatever is listening has any interest, there's some resources out there. I think Angela mentioned that before. We'll publish those links. So, this podcast, I really enjoyed it because we ask a few questions. I ask a few dumb questions. I always do. But our listeners, then we want them to generate and go, oh, I wish they would have asked this. Well, then reach out to your experts in your area, get those clarifications, understand more about what's going on and how you fit into the whole scheme of things. And that's what I saw from this podcast. So Angela, it's been great just listening and truly learning a little more detail. Again, I mentioned before, behind the scenes that not everybody knows is happening. There's a lot of stuff behind the scenes that people would be more thankful for if they really understood what was going on. But in a sense, we're glad it's behind the scenes because that means it's not in the forefront every day. So thank you.
Yep, absolutely. An embarrassment of riches, so to speak, in terms of resources. But again, those resources, a lot of them have been there for a long time. People just need to take advantage of them, either as a coalition, collaboratively, or individually as an organization. Don't rely on other people to do your work. Some of that hard work of identifying what resources you have and what local monitoring equipment and protocols you have are absolutely necessary. So, again, I certainly appreciate it. And Al, anything else for the good of the order? You do our reminders.
I think, well, I'll give you a reminder. Yeah, since Mike is not here, thank you for reminding me that Mike's not here. So for those listeners, remember, we have a Gmail account, readiness.rewired@gmail.com. You can reach out and send us information. We'll pass it on to people like Angela. We'll put Angela's link out there. But, if you're listening to the podcast, go out there and subscribe. It's free. Go out there and give us a thumbs up if you think, we're doing okay. Give us a thumbs down if you think we suck. That's what Mike will tell you. Because we want to know, how can we improve? But we're just having fun doing a podcast and bringing some emergency preparedness related topics to maybe the forefront for everybody. So thanks everybody for listening.
Absolutely. Thank you, Angela, once again for joining us and with some real great stuff. And clearly this is it's a passion, but it's also a talent, and you have many skills and resources. Yeah. So I hope people continue to take advantage of what you guys offer out there.
Yeah, feel free to reach out directly to me. But again, Iowa's infrastructure for radiation protection is really strong with the CST and HHS and Iowa State and all of the collaboration. So, feel free to reach in. They're more than happy to help support. And I'm happy to help support as well from any resources, training, exercise. Just reach out.